I want to start before we kind of get into this by giving a little bit of a primer on the state of childcare in the United States. Before we even got into this pandemic, before any of us heard of coronavirus, how was childcare doing? And this is going to be sort of a 5-minute quick tour. We were joking beforehand, I get to be Mr. Happy Fun Guy. The 5-minute quick tour of the very failed system that is American childcare. So if you want to go to the next slide there, when I was writing my book, I basically developed what I call the compass rose of the United States childcare crisis, and sort of 4 nodes of why we are in this situation before, again, any of this started with coronavirus, where it was unaffordable, inaccessible, and not nearly as high quality as it needed to be for parents and children to be able to thrive. And you really can't understand why the U.S. childcare is in the situation, the sort of hot mess that it is, without starting with limited public investment because of historical disdain for mothers working. And this is sort of a thread that animates pretty much everything else that leads to why we're in the state we're in. So if we go to the next slide, I feel like this quote largely does the work for me. So this is, I'm just going to read it out loud. Good mother care during the earliest childhood is the surest way to produce useful and well-adjusted citizens. It doesn't make sense to let mothers go to work making dresses or tapping typewriters in an office and have them pay other people to do a poor job of bringing up their own children. A day nursery or a baby farm is no good for an infant. Now, that wasn't a reactionary politician, you know, it wasn't someone writing in the mid-1800s. That was Dr. Spock. That was Dr. Spock in 1958. 1958 is not that long ago. People born in 1958 are 62 years old today. And so if you think that that someone as respected in the field of child development as Dr. Spock, and as late as 1958, is talking about the fact that children shouldn't be in external child care, young children should be at home with their mothers, how much that colors the whole cultural thought towards that question. And if you think that young children should be home with their mothers, and if you have junk science backing it up, saying that actually there's harm being done to those children and to those mothers by separating them during the day, then the last thing you would want to do is create a publicly funded childcare system. Why would you do that? Actually, you would actively want to not do that. And that is precisely what the United States has done. So if you go to the next slide, you will see this is public spending on early childhood education and care. You don't need to look at all the numbers, but if you want to find the United States, take your eyes way to the right, and we are right about 3rd or 4th from the bottom in terms of percentage of GDP. So there is very, very little public money going into the system, which is a problem because a lot of people need to use the system. Because if you go to the next slide, despite Dr. Spock and the rest of the people who would like mothers to not be working, mothers have been working. And that is, we've seen a huge increase since even just 1975, as you can see from this, to the point that now 2/3 of all children aged 5 or under have, previous to the COVID pandemic, had their mothers in the workforce. And so thankfully we've come to a place as a society where we have accepted that that is a legitimate choice that mothers get to make, and that mothers have indeed joined the workforce in large numbers. But the problem is when you have a lot of people coming into a system that has not been set up to take them, you run into problems. And so childcare is expensive. It's expensive to deliver because it's an extremely, it has extremely low adult to child ratios. You know, I taught 4th grade when back in the day, I could have 25, 30, 35 kids in my class. Maybe not a good idea to have 35 kids in my class, but I legitimately could. A teacher of infants can have 4 to 5 children under their care in most states. You know, toddlers, you maybe can have 8, but more likely 6 or 7. Again, those numbers make childcare very, very, very expensive. But there's no public money going into it. So where do child care programs turn? They turn to parent fees. Except parents can't pay that much money. We're already paying way too much for childcare. You're paying an average of $10,000 for full-time care. In some states, it's much, much higher than that. And so with providers not able to charge what they need, and more parents needing care, what you end up is you getting, and if you go to the next slide, you end up with more demand and less supply. So since 2005, we've had a huge loss in childcare supply for a couple of different reasons, but especially among our smaller family childcare homes. The economics model is so broken that it's not working, and we're seeing huge closures. So lots of parents need care. There's not much care around. Care is too expensive, but providers can't actually keep themselves solvent, nor are they paying their educators well. These very hardworking, essential workers are getting basically a little over minimum wage. The average salary or the average wage for a center teacher is somewhere around $11 an hour. So this has sort of put us in a situation where we have an extremely fragile childcare system, and we're seeing that laid bare right now, where we're having many programs facing closures as a result of having any loss of revenue, and then all of a sudden they're seeing huge losses of revenue as a result of the COVID pandemic. And so we have a childcare system that is very limited public investment, that is charging parents too much, that is not able to keep their doors open. And as a result, we haven't talked about quality, which we know is the most important thing for child development, gets caught up in all of this mix. So I like to say the system is working for no one. It is not working for parents, it is not working for providers, it is not working for practitioners, and it is most certainly not working for children. So we have a broken system in every way imaginable, a failed market, and we really need to start rethinking what are we going to do about it. And that's one reason why I'm really glad that we have groups like Care for All Children.